Community Primary Care Champion Fellowship is a 12-month training dedicated to developing transformational providers. While this fellowship functions to equip physician and physician assistant primary care providers with an enhanced understanding of social determinants of health, substance use disorders, mental health, medical education, and quality improvement, our ever-important sixth curricular element is wellness and burnout. Burnout is most commonly derived from extreme and chronic pressures at work, leading to physical and emotional exhaustion, alienation from activities, and reduced occupational performance, which ultimately have the potential for impacting patient care. With burnout's effects being so adverse, it is important to recognize the prevalence of burnout in our healthcare system. A recent Medscape survey demonstrated over 40% of family practice physicians are experiencing active burnout. And while this number is staggering, burnout is not limited to only physicians, with initial recent reports suggesting similar highs amongst physician assistants. As we wrap up our third year of fellows, we continue to collect data through 3 wellness inventories, assessing participating fellows' burnout and wellness pre- and post-fellowship. Although we have received positive qualitative feedback from fellows regarding the fellowship's camaraderie impact on their overall well-being, more specific elements in the fellowship that target reducing burnout include virtual well-being modules, readings, and activities including trials of various wellness apps. Additionally, our fellows participate in engaging discussions with faculty and community leaders dedicated to addressing the wellness gap in healthcare employees and innovative strategies to combating PA and doctor burnout.
The data analyzed is from the first 2 years of fellowship, totaling 9 fellows, 6 physician and 3 PA. In reviewing the results of the 3 wellness inventories, the Maslack Burnout Inventory, the Utrecht Work Engagement Survey, and the Perceived Stress Score, taken before fellowship and upon completion, showed changes in a positive direction, but not enough to be statistically significant. Importantly, scores did not worsen, not even during year 2, which was impacted by the COVID-19 pandemic. Analysis of pre- and post-fellowship self-assessment questionnaire questions on well-being again showed movement in a positive direction. Fellows were more likely to characterize provider wellness as being extremely important to them, and they reported they were self-assessing for signs and symptoms of burnout, stress, and work engagement more often, although none of these achieved statistical significance. There was a statistically significant change in increased knowledge of resources for personal wellness as well as for organizational wellness, which with each of those reaching a p-value of 0.008. The qualitative analysis of the fellow focus groups revealed several insights. Fellows described the need to learn practical solutions to systems issues impacting their wellness. Managing inboxes was one example shared. Fellows expressed difficulty in maintaining wellness goals in the face of so many competing demands. And fellows identified the camaraderie of other fellows as a boost to their personal wellness. One fellow commented, "Just getting to see each other and share experiences of difficult patient encounters, that was actually really good for my wellness."
I will be providing a brief overview of the discussion portion of this project. While our results are preliminary and include a limited number of 9 at this time, our results demonstrate a positive impact on primary care provider wellness from participation in the fellowship. Specifically, the fellows' view of wellness importance, frequency of wellness self-assessments, and knowledge of tools utilized to boost self-wellness improved when comparing pre- and post self-assessments. In addition to our previously reported self-evaluation surveys, follow-up interviews and focus groups are also conducted throughout the fellowship to gain additional insight from the fellows' feedback and to elicit impactful changes. It is recognized this is an evolving process, especially in the midst of COVID. As a current fellow graduating in August 2021 from an entirely virtual fellowship, my own wellness, both personal and professional, has been greatly impacted by participation in this fellowship. Through readings, modules, lectures, and group discussions, I have learned and put into practice tools such as taking time for daily stretching and meditation, which has reduced anxiety and stress and has overall improved my quality of life. I have been able to recommend some of these resources to my patients as well. In addition, I implemented a quality improvement project with fellow advanced practice providers at my practice site, which sought to improve work-life wellness over a series of 2 interventions. I will forever be thankful to have been part of this fellowship and to have been given tools to be a force of change in my life, my patients' lives, and the lives of my colleagues. There will be 5 fellows graduating this year, and we look forward to the upcoming data analysis as several changes to curriculum were made based on early feedback. Thank you for stopping by our poster. Please feel free to email us with any questions.